Good day, madam. I'm Sri Radhishandra. I'm from BPT 26B. Today, I'm going to talk about cellulitis. What is cellulitis? Cellulitis is a bacterial infection of your skin and the tissues beneath your skin. It mostly commonly affects the lower part of your body, including the legs, feet, and toes. However, it can occur in any part of your body. It also commonly appears on your face, arms, hands, and the fingers. So, how does the cellulitis affect the body? Cellulitis causes swelling and pain. If we have cellulitis on our hand or feet, it may be challenging to close our hands or walk. A cellulitis infection may cause flu-like the symptoms, including a fever higher than 38 degrees Celsius, chills, sweats, body aches, and fatigue. So, what are the symptoms of the cellulitis? The symptoms of cellulitis may include pain, tenderness, edema, which is swelling, warmth, discoloration. It could be red, purple, or slightly darker than your usual skin color that may look like a rash. Next is fluid-filled blisters. Skin surface look lumpy or pitted like an orange skin, fever, chills, and the last is fatigue. So the next part is what is the main cause of the cellulitis? Cellulitis causes by many different bacteria. However, Streptococcus, which is strep, and Staphylococcus, which is staph, causes most cases of cellulitis. And this is the picture of Streptococcus and Staphylococcus. Next part is about what does the beginning of the cellulitis look like. When you first get cellulitis, your skin looks like slightly discolored. It may feel slightly warm to the touch. As the infection spreads, the discoloration gets darker as your skin swells and becomes tender. The test will be done to diagnose the cellulitis. There are three tests. First one is blood test. A blood test will confirm whether the cellulitis infection has spread to your blood. As for the second test is skin test. A skin test will identify the type of bacteria responsible for the cellulitis, which helps your healthcare provider prescribe the most appropriate antibiotic. The last test will be bacterial culture. A bacterial culture will identify the type of bacteria responsible for your cellulitis. The last part is about how can we reduce the risk. So we can reduce the risk of developing cellulitis by cleaning the wounds or sores with antibacterial soaps and water. Next is applying an antibiotic ointment on the wounds or sores and covering the wounds or sores with a bandage to prevent dirt or bacteria from entering the area. Next is refraining from touching or rubbing the affected areas. The last is getting medical attention right away for any deep cuts or puncture wounds. These are the references that I get some information about the cellulitis. And that's all for me.